All right, Kelly, good morning.
Good morning.
You had surgery last week.
On Wednesday.
On Wednesday. And you want to give, let's see, if you were a future patient, are there any tips or pointers or experience you can pass on to our patients? Or
Go in with the knowledge that you give us and know what you're getting into, and if you, as long knowledge is powerful, and I knew everything that I was getting into, and it went smooth and beautiful.
Good, good. So your surgery did okay?
It was great.
And post-operatively, the night after surgery, the nurses did okay?
The nurses were fabulous.
Good.
The nurses were great.
Appreciate that.
Yeah, they're awesome. I sent in a nice note.
A little note, thank you.
Yes.
We appreciate that. You can do a wave and shout out thank you to everybody on fourth floor. We appreciate their good work.
Wonderful.
And then I think I've heard from you by email that the past week has gone pretty well.
The past week went great. I'm a deep breath taker. I just take deep breaths because I have children, and I learned to, And so I was concerned. It hurt. It hurt to take a deep breath, and I didn't, so it was just a little uncomfortable. And once I realized it hurt, then I was like, I wanted to take more.
Oh, good.
More deep breaths. So, but what was really weird, I think I told you, is if I'm laying in bed on the left or the right side, I could take all the deep breaths I wanted, and it didn't hurt at all. It was the strangest thing. But now, today, I don't have any pain. It's like it never happened.
Okay. Should we talk for a second about that pain?
It was just, it's just uncomfortable. It's just a little discomfort.
And that pain is the pain of the surgery. In other words, that is from the crushing and cutting and stapling on the stomach. And of course, just a moment ago, we talked to Tracy, who had a lot of pain. Sometimes when she swallowed, the pain was over a 10, and most of the time it was a 3 or 4. And sounds like your pain, listening to you, the numbers, you graded as a 2, 3?
Yes, not bad at all. Just a little discomfort.
Right.
Just because I never get sick, so I'm always well and happy.
And so we're disappointed. We'd prefer that you not have any pain at all. But it's not terribly surprising you have some pain because you had major surgery.
Right.
But you were able to get through it and do okay. And
do wonderful. Do wonderful. Yes.
Good. And the rest of your week has been kind of okay?
It's been great. I didn't get the part of just sucking on the pretzels because I eat them.
You can eat pretzels. The point is, and I think if I can go into the viewers here, you were saying if you ate a certain number of pretzels, you felt a big kind of plug of them.
Right here. So you can't, like I'm used to, the pretzels. And
that's a good thing. Do that one again.
Yeah, I know, that's what I'm used to doing.
Yeah.
So
that's
now
a universal sign of post-MGB.
Right. Yeah, right, exactly. Just like a Hoover.
Yeah, this is like, no more of that. That's the universal.
So I had 2 back to back, and boy, I had a lump right here. It was like, oh my goodness. And if I drink a little water,
Right. Now, it's not that you can't have pretzels. That's that's a double negative. So it's not that you can't have pretzels, or to say it without the double negative. You may have pretzels, but everything is going to be new to you with your new stomach. And this is true of all of you. And that is, pre-operatively, if I told you to eat 2 pretzels, you'd say, sure, no problem, nothing to worry about, I'll eat 2 pretzels without even thinking about it. Not in the first days after the MGB. You may still have those 2 pretzels, but as you pointed out, 2 pretzels fairly quickly, one after the other, and you may plug up the whole works.
Correct.
So our advice to our video watchers and other people who might have the MGB is that the first week after surgery, it's really remarkable that you can eat anything at all.
Right.
Because, let me tell you that when I was trained as a general surgeon some years ago, it's in the 70s, no one would dare feed somebody who just had this type of surgery for a week after. You wouldn't have anything at all. You'd have a tube in your nose called a nasogastric tube, frequently a tube in your bladder. You might be in the intensive care unit for several days afterwards. You might have a spinal catheter in your back for pain relief. I mean, the treatment is quite different. So the fact that you can eat anything and can leave the hospital is still moderately radical. Our short hospital stay, that is a median of around 1 day for the vast majority of people, except for Tracy, is one of the shortest hospital stays in the world. So that new week and the coming weeks for you and the coming months for you, there's going to be this tremendous change in what you can eat. Can you eat pretzels? Yes. Can you eat a whole bag of pretzels quick? No chance. Right, no chance. So you're learning that, and you're going to have to learn this, if you're like most of our patients, a dozen more times. Because things are different this week, they're going to be different next week. Like next week, 2 pretzels, maybe okay. But will a hamburger be okay?
No.
Okay. Will a hamburger be okay next year? Maybe a little bit. Mm-hmm. Fried chicken tomorrow? No. Fried chicken in a year. So you have to get used to that. And there's not, and I think Sandy was saying, I was kind of maybe correct, she said, oh no, you can't eat pretzels. We disagree with that. You can, but everything is in these really small amounts. Mm-hmm. And we just got a call from a patient you may remember sitting with you in clinic last week by the name of Kelly. She had black hair, and she was in the upstairs and sitting in the back with her family. Yes. She was there with her daughter and her son. She called in terrible pain last night. Terrible pain. So we're asking, what did you eat? She says, no, I'm in terrible pain. I go, tell me what you ate. No, I'm in terrible. Well, she's a week ahead of you, and she had mashed potatoes and a whole hard-boiled egg. Now, in a month or 2 months, yeah, that's okay, Kelly. But not 2 weeks afterwards. And she may have a little bit of egg and mashed potatoes, but not as much as she ate. So again, she went through a very unpleasant time because she's eating what she thought was normal and reasonable, like 2 pretzels seem reasonable, but not for your new stomach and not in the first week. And for Kelly and other people, a whole boiled, hard-boiled egg and a half a cup or a cup of mashed potatoes 2 weeks out will hurt you.
Right.
Yeah. So
if you just eat, slow and
then
follow the rules, the guidelines. Mm-hmm. I mean, if you follow those, you're all right, and you listen to your body, and
give it a chance. Like if you're going, let's suppose you get a craving for a boiled egg and mashed potatoes. There's nothing wrong with that, as long as you eat and then put down the fork.
Right.
Take a breath. A lot of us get in the habit, I think, of eating and talking. Oh, this is great. Right. How was your day today? Yes.
A friend of mine who's post-op a year bought one of those sand timers, and that's how she got used to mentally feeling what it feels like.
Right. There are a lot of tricks like that. One is you can use a little baby spoon, so that the amount you eat is less.
Right,
Another thing that we say is, there's this kind of famous quotes from the movies, famous, Louis, this looks like the beginning of a beautiful friendship, or things like that. A famous quote is, put down the gun and nobody gets hurt. So we changed that a little bit for the MGB patients, say, put down your fork between bites. In other words, have a bite, put it down, and wait a few seconds. And a timer is not a bad thing to do. But if you eat like you vacuum it up, like a lot of us, I think, have a busy lifestyle, and you're quick, let's go, let's busy.
The old.
Yeah. If you do that, we will come by your house and hurt you.
Right. And it's taken me quite a while to eat a little thing of yogurt. Right. And I have it just on the counter, and I'm putzing around the house, and even with soup. I mean, I'll have it on the counter, and I'll take a bite and do some things.
And that's the guideline. That's what we'd like to pass on to our viewers.
Definitely.
And say that again is, we have this tremendously effective surgery, but especially when you're brand new, but even later on, you have to listen to your body a little bit more, because we're going to intend to block and slow down that ability to eat a whole bunch of food fast.
Right.
I'm not even hungry.
I'm sorry?
Not even hungry.
I don't think I heard you.
I'm not even hungry. It's the weirdest feeling.
We forgot to say she lost 10 pounds.
Oh, right.
Yeah. Well, I had another complication.
Yeah.
Don't you remember? I was just bawling my eyes out.
Oh, yeah, that.
It had a little bit of tears, yeah. Yeah, so the estrogen.
Yeah.
You can eat saltines if you need the salt.
Saltines are a great choice. We heard Tracy also say, though, sometimes it seems like you can't get enough saltines to replace what you've lost. So let me just give you a quick summary of this one more time, and it works like this. A person who's heavy inappropriately retains extra salt and water. Okay? In other words, obesity is not just a cosmetic thing, it's a physiologic, hormonal abnormality. Okay? And this hormonal abnormality includes release of salt-retaining hormones, like cortisol or cortisone, another hormone that's released from the adrenal gland called aldosterone. It releases these chemicals, and your body eats salt and has a regulatory system, and it doesn't release enough salt. By not releasing enough salt, you get things like high blood pressure and shortness of breath and fluid in your lungs and stuff like that. As soon as we do the surgery, this abnormality is reversed. There is, instead of the body retaining salt, you begin to lose salt and water in your urine, just as if you'd taken a tablet of a diuretic pill. And this massive loss of salt and fluid is part of the early weight loss, like 10 pounds of water. Okay? But the problem is, it's so powerful, it overwhelms our patients. And unless they keep up with extra salt and replacing it, they will become dehydrated and weak, even to pass out, and sometimes have to come to the hospital excuse me, get intravenous fluids. But that's a demonstration of just how how powerful the surgery is.
So the saltines okay, but a pretzel is...
The pretzels,
They're both okay,
yeah,
taken slowly.
Slowly.
Nothing is okay fast. Everything is okay very slowly. Now, some things are easier to swallow than others. So pretzels and crackers, particularly saltines, work better than, say, potato chips. The reason is the fat content. So dropping a raw potato chip with its associated grease into the small intestine is tougher on it. So if you were to measure the number of potato chips you could eat compared to the number of pretzels and the number of saltine crackers, we find that the lower fat content foods can carry in more salt with less upset stomach.
How about some salt water?
Well, we have had a lot of people ask that question, and my opinion is, if you ask me what was the most tasty choice, salt water would be last on my list. If you find that drinking salt water is good for you, it's okay with me, but it doesn't sound attractive to me. I would much prefer a glass of water and a saltine cracker, as opposed to, I think I'll mix up some salt water and drink it. You'll rarely find that on the menu of fine restaurants. So it's not a very tasty choice.
Other than those two things, is something like Gatorade an option for getting salt?
That's exactly why we recommend it. And again, the summary on this is pretty interesting. When you look at the past 100 years, people, Sandy, can we wait on that? Yeah, thanks. When you look at the past 100 years and estimate what was the most valuable medical development in the past 100 years, you know, polio, penicillin, you know, the polio vaccine, which was the greatest development that saved the most lives? If you look at that, many people argue that Gatorade, or its version called oral rehydration solution, might be judged as the most valuable development in healthcare in the past 100 years.
Wow.
The reason is because of cholera. Cholera is a diarrhea-type illness that kills hundreds of thousands of people throughout the third world. And basically the bug causes this massive fluid diarrhea. You lose tons of water and the people die of dehydration. Lots of little children, lots of people. And they're in third world countries, so intravenous fluids is not really an option because of their cost and sterilization. So a variety of aid workers found that you could just measure what they were losing and put it back in as a mix in a drink. And when they mixed up that drink, if you put a name on it, it's called Gatorade. There's a little bit of sugar, a little bit of sodium, and a little bit of potassium. So the best way to resuscitate our patients post-op is actually as much Gatorade as you can drink. Now, beware, because then people say, oh, Dr. Rutley says I should drink Gatorade always. And we're not saying that. We're saying that Gatorade is a powerful medicine with its sugar and sodium and potassium when you're dehydrated or when you're low on fluid or salt, which often happens to our patients post-op. But it's not a foundational part of your diet. You know, in other words, your diet should generally be healthy foods. And Gatorade is not a healthy food. It's a very valuable medicine.
Excellent.
Good question.
So what I wanted to say about my energy level, though, is what I noticed this week, and I'm a very energetic person, but before, pre-op, I would have to have a lot of caffeine in the form of Starbucks. Not necessarily coffee, tea, whatever.
Okay.
But, and I would have days that I'm like this, Okay, and my body's constantly trying to digest the food, the garbage food that I would put into it, so I was always fighting fatigue, even though I'm very energetic, so I'm always, got caffeine going. But so now that I'm not putting all the garbage in my body, I've had sustained energy that's been phenomenal. In fact, I'm not sleeping that well because I really don't need, it doesn't appear that I need the rest that I used to need because of all the, just because I'm not fighting, my body's not fighting to digest all the stuff that I used to put in it.
Good.
So I've had great energy, and I've only had the part where I ate too much, like twice, and hopefully I've learned already that.
Well, you'll probably have more of those experiences until you become a veteran of owning the MGB, and you'll learn by kind of trial and error. The big piece of advice that you can take home is eat slowly.
Eat slow.
Yeah, and when you don't do that, we'll remind you.
Okay. Yeah, right. It'll be right there.
Right.
Right there.
Should we take your staples out?
Yes, please.
Okay. Do you have your staples? I've got it here.
You have it. And the cream on your tummy, if you put cream on the where the bandages were, and then rub it, it'll come off, all the goopies.
So we can have a soak bath?
We generally recommend that you think about the reason for us keeping you out of the bathtub in the first place.
And I understand that.
Okay, let me take the staples out and then we'll talk about it. But basically what we say is that if you were to soak in the tub, there's a slim possibility that with the period of time in the tub, you might be able to stay long enough to open up the wound. The little scab could open up. If it did, then you have the risk that something from the outside could get underneath the skin. And if it was a staph bug or something like that, that'd be a bad thing. So a quick shower we generally think is okay. Don't spend forever in there. But we think that a long bath or a pool, where you're in and under the water for a long time is slightly dangerous. So we recommend until that wound is really healed and sealed, stay out of the tub and stay out of the swimming pool. And that's variable, but sometime between 1 and 2 weeks after surgery.
Okay.
Oh, it looks wonderful. It's healing up great.
I can break back out the magnets now.
Well, these are non-magnetic.
Oh, are they? Oh, okay. And I haven't had any dizziness or anything like that.
Well, you're doing a good job then of keeping that.
I must be.
Well, also, you don't have as big a surgery as everybody else.
Right, so, that feels good. Okay.
Other questions that we should answer for you? Anything that we should go over or talk about?
No, but I might think of something later. Right now I'm
then
good.
we'll-
I'm ready to sit down.
Applause. Thank you very much.